Record. Yep, perfect. All right. So I wanted to get together and start to do some of these Skype meetings. I reckon they're going to be a really good way of us touching base quite often. And if we can get through some material like this regularly, then when we're face-to-face, we can do better things like role-playing and challenging each other and bouncing ideas around, which is easy to do face-to-face, whereas these ones, a bit more about just covering some information, having a think about it, and then coming back together, I think, is the way to go. Now, you and I have already chatted a bit about the report of findings visit, but I actually think that this is a visit that we are struggling with as a team because the stats are just saying that. The stats are saying that patients aren't getting through to their review. They're changing their schedule pretty early, and that's a fault of our own in that we're not explaining it well enough, and we're not getting a commitment out of the patients to get to that point. And I'll touch base on why that I think that's happening and what we should do about that.
Are you taking?
Yep.
Okay.
You just have to check your email, Beck, to just log in. All right. So I was going to go through a couple of things about some notes that I thought about as the report of findings. Helena talked to me a little bit about not sure about what to say, how much to cover, how much to explain the body-brain connection and the complications of the subluxation. And, and I just think that we overcomplicate it. I think that if there is a spiel that we can say which is very simple, which is congruent with what we believe in, what our philosophy is, then I think we have a much better chance of them actually being compliant and sticking to what we're asking. So that's number one. Try and keep it simple. Don't overcomplicate it. Second thing is, let's not treat their symptoms. I know that they're coming in with symptoms, and I know that we want to help them recover quickly from that. But you can still frame what you're doing as a way of helping their body heal to address their symptoms without saying you're treating their symptoms. And I think it's going to build a rod for our backs if we keep saying that we're adjusting a subluxation to affect their symptom, and then their symptom doesn't get better, then there's really no reason for them to stay with us. But if we can discuss the other reasons why we would be adjusting them and that their body has to heal, then there's a much better chance that they are going to be patient with the healing process. I want to try to discuss with them the journey back to health through their adjustments. So it's a journey, and I think it's a really good word to use because it's a journey of decline that they got there in the first place, and so we're turning the boat around and heading back towards being healthy. The build-up took a long time, and so there's a great question, which is, well, how long do you think it's going to take you to recover from this condition, this problem that you have? By asking them, they often will then have a better understanding because they've thought about it and gone, oh, well, it did take 9 months to come on. Yeah, it's going to take a few months. If they say 2 months, that's better than 2 visits. So at least they've got some concept that it's...
Hello? Darren, are you there?
Yeah, I'm still here.
Sorry, it was broken up there.
Ah, sorry.
That's okay.
Anyway, can you still hear me now?
It might have been me because I just changed to the 2.4.
Coming up saying the internet connection unstable, but I have full reception here.
Yeah, and I just changed mine. Are you on 2.4, Daz, or 5?
Let me just have a quick look. I'm on 5G, so you can be on 2.4.
Oh, okay.
That's fine. If it gets too unstable, I'll get you to log off, Beck. Cool. So, talking about
yours isn't very good.
What's that?
Okay.
I can. You're cutting in and out, though.
You're cutting in and out.
Yeah, no, I think it's you, Daz.
Yeah, I think it's you.
Why do you think?
How about you go on?
Oh.
Yeah, I think it's you.
Okay. Well, I'm down here. No, I think it's just because you've logged onto the same Wi-Fi. That's all it is. So that's fine.
Okay.
Don't worry.
Actually,
Otherwise,
I had something to add to that.
yep.
I remember Russ Rosen talking about when you're in the report of findings, what you want to get across to them is that they've got a health problem rather than a back problem or a spine problem or a headache problem, that their problem is actually their body's inability to have fixed it themselves rather than the problem itself. So if you can relate the pain that they've got to well, your body's self-healing and self-regulating. Why didn't it self-heal and self-regulate when it did for 10 years? Why has it stopped doing that?
Yeah.
And so if you introduce the idea of it's a health problem and an inability of your body to be able to do it itself, that opens up a huge big conversation about, well, what else can't your body do, or what else will your body not be able to do later on? Which I thought was quite interesting.
Mm-hmm. Yep, absolutely. So if you want to discuss the different stages of health and of their recovery, I use the 3 stages, which is basically we're trying to get some early healing of their body to decrease their symptoms and reduce their inflammation. That's really all we're doing in the first 6 weeks. Then beyond that, when their symptoms are settling down and their inflammation has settled down, we're starting to do some remodeling. We're starting to do some strengthening of their body. And then once it seems to be stable and holding a better position and perhaps functioning better, we're trying to maintain or produce optimal function. Now, I don't mind you talking about maintenance and maintaining good function or striving for optimal function. That's up for debate about how you want to promote that ongoing management of care. But at least it puts in their mind that there are different stages of healing and what they should expect over that time frame. So the way I think we can convey that is to use words that reflect that purpose and help educate them, because they've come in thinking about pain and symptoms, and we want to say things like, I want to help improve your healing capacity. It's not healing at the moment, exactly what you said, Beck. Your body's struggling. Let's give it a helping hand to heal better. Let's improve your balance, not just your vestibular balance, but let's improve the balance of your muscles. Let's improve the balance of your center of gravity. And I think they understand that when something's out of balance, then it doesn't perform as well. Let's reduce the pressure on that structure. Let's reduce the pressure on your tissue that's in lesion, let's say. These are all good ways of explaining what we're doing without turning to, let me treat your pain. Let's improve better nerve flow to that area. Let's improve your movement of that area. I think they're all acceptable at different stages of that person's recovery, and they're better ways of reflecting what we're trying to say. Because we're more than just musculoskeletal therapists. We want to show them that that's not what we do. I'll say to people, you know what, most people that come to see me, they come just to stay well when they get there. And that's kind of all of my practice. So they see that using chiropractic to keep themselves healthy and well is normal. And it's what most people do, and it's what happens really regularly in our office. And they're the kind of the indifferent one that's come in with symptoms and pain. I think that's a really good framework to try and get them their head around. We'll talk about sort of some of the other things to say during that report of findings. In a bit. Helene just said, hi, having trouble with the links for iPhone. Have you started? Yeah, I will just say.
While you're doing that, I'll just throw in the 2 cents worth in about that. The nice thing about getting to think about the problem's been there for a really long time, but their body's been doing it themselves, it makes them feel like they're active in the process as well. It's not like they're coming to you for an adjustment that's going to fix a problem. It's like something that's going to help them to do what they're naturally able to do. So it kind of taps into those sort of the yoga crowd and the people who like taking supplements and doing exercise, because I can help myself. And so rather than coming to us as a therapist, it's just someone who's almost like a coach to say, I'm going to do my thing to help your body do its thing, rather than I'm the source of the healing.
Yeah.
It just makes it easier to talk to people who don't like being dependent on stuff, which I reckon, particularly in Surrey Hills, I don't think so much in Artarmon. Surrey Hills crowd don't kind of like to feel like they have to go to the chiropractor. They like to want to go to the chiropractor because it's helping them be better.
Well, and you want it to be their choice. That's the thing. You don't want them saying, "Oh, I'm doing good. Darren said I have to go." You're going, this is something that fits well into your paradigm of your way you want to run your body. You do yoga, you eat organic food. Of course, you go to the chiropractor because that's one of the missing links that is going to bring you back to health. So it makes them feel like they've made a good choice, and it's congruent with their way of thinking about health. So yeah.
It's also, we were going to talk about prescribing and supplements and exercises and
I'll get to that
stuff.
Mm-hmm.
But okay, when you get to that, I've got a point to make about it.
All right, cool. So let's talk about two. Oh, okay, we'll get straight into that now. Then I'll jump it down a little bit. So too much information, I've put the heading as, and I'll pass around these reporter findings notes at the end. But I think the more that we give on the first 2 visits, which is nutrition, exercise, dietary changes, changes in their medication, how to manage their muscle pain and their inflammation, in effect will water down the impact of the adjustments that you're about to give. And in doing so, that will undermine the importance of why they would want to have regular adjusting later on and then get ongoing management. I'm not saying that they're not important, and I definitely would bring it up later on if your regular adjusting requires you to do that at a point in time, and if you think that it's going to take them to the next level of healing. But, I don't know that giving them everything on the first 2 visits is, although that's what they think they want and they're asking for it, they're more likely to just leave and say, thanks very much, I've got the information, I'm just going to go and manage it myself now. And they haven't really grasped the concept that actually what's most important are the adjustments and the course of treatment that you're about to prescribe, and following through. Also, if you give them everything on the first 2 visits, that doesn't serve you because you haven't had a chance to give them any sort of quality of care. 1 adjustment and 2 adjustments don't do enough. It doesn't serve the patient because they have got no understanding of the benefit and the power of chiropractic and the adjustments. And also it doesn't serve the community to be educated in chiropractic, because then they just have stopped care. They think that chiropractic is just a bunch of these things that we put together, and it hasn't really reflected what we actually do. So you've got to buy yourself some time. If you don't have 12 visits up, with someone, how do you expect they're going to sign on for a lifetime of care? You really got to say, right, we need to have this time together. 1, to give you enough adjustments so that you're going to recover and get proper care. 2, it gives you time to educate them and drip feed the information and get them taking stuff in twice a week that's just really going to build their value about what you're doing, and appreciate what you're doing. Otherwise, when we do all those things, we're being over-caring to the point that it's undermining what you actually believe, and you're going to set yourself up to fail. And you don't want that. Well, you don't want to fail because you really want them to get better, and you gave them all this information, and then all of a sudden they just stopped.
I've got some really good language around that as well.
Yep.
And because most people in the first visit will say, and what can I do at home? And like sometimes it's appropriate to give them small exercises, but I reckon it's probably not appropriate to do too much, because what I say to them is we've got to get your brain talking to your body, so that if you put a supplement in, it's going to absorb. There's no point until your guts are working properly, putting good food in there. It's no point putting magnesium in until it's going to be absorbed properly and your body knows what to do with it. There's no point doing a muscle exercise until your pelvis is stable enough to be able to do that usefully. And so if you kind of say, yep, excellent, we're going to talk about all that stuff, but we really need to get your body functioning really well so that you'll get the $60 value out of your magnesium, or the half an hour that you're putting into exercises. If you're going to put in half an hour, you want half an hour worth of bang. You don't want to get 15 minutes worth of. So kind of really connecting that idea of getting value out of the exercises or value out of the supplement than an alternative to something else. You still thinking? You're writing down my salient points.
No, I was just writing a quick bit to Helena. She's trying to hop on. Yeah. No, I did hear that, and I think that I like to say, I don't want you to do anything. I actually don't want you to do anything because I want to know that what I'm doing is working. Because I need to know if I'm doing that's something that your body needs and it's working well. So, were you doing any yoga before now? Great, don't start. Were you at the gym? All right, I just want you to just don't change anything up. Why would you strengthen a muscle and work your body really hard when it's not in a very good position and it's not able to, you wouldn't strengthen around a poor position. Let's put it in a better postural alignment. Let's put it functioning better. And then you work around that to hold that position. Howdy.
Hello.
Helena has just joined us, so that's good. So basically I wanted to try to just curb how much we're adding in at that point in time, and then slowly add it in as time goes on, and then they will really appreciate getting to the review, going through that stuff with them, and making them more empowered down the track, not straight away. So basically, then I was going to say, well, why don't we just what I do is I like to finish the report of findings by giving them a choice, then if they decide to choose what you've recommended to them, then I want to hear them say, yep, that's what I want to do. So there's that verbal commitment. So often what I say to them is, look, when you where you get to with chiropractic care, it's always up to you. So we're committed to helping you be as great and as healthy as you want to be. So the first step is to get your symptoms under control, because that's what you're here for, and I'm here to try and help you with that. But beyond that comes a lot more benefits with chiropractic, like increased vitality, health, well-being, and to get you over that first hurdle, to give your body a chance, you need to commit to 6 weeks of treatment. Don't use the word treatment. 6 weeks of care.
20 cents in the jar for you.
I will put it into so you do 6 weeks of care and then I say, and then what we're going to do is we're going to review your body, and we're going to ascertain where you need to go from there. Are we really happy and you want to stop care because that's what you were here for, just to get out of pain? Great. Are you here because we want to try and strengthen around that, what with the changes that we've made, and create some further healing? Excellent. Are we not making any changes, and do we need to go in a different direction? And I've got a lot of resources where I can help you. I'm not going to leave you in the lurch if this isn't working. I can help you with massage, acupuncture, naturopathy, other therapists that we work with to get the best results. So they know that you're not just talking about yourself. You're kind of we're not going to let them go, but you're telling them that you're not going to settle for something that's not great. And they want to hear that. And then I'll say, look, we've just got to give it a chance to heal and repair. And I think people understand that process. And then they will say, yep, no worries. So great, let's focus on the short term, and then we'll look at the long-term options down the track. But you've broached it with them on that second visit, and then they'll come back at the review, and then you can go through it a bit more.
I've got a step before that,
yep,
that I just wanted to put in, that I don't know whether this is across the board that we all do this poorly, but I have done it very poorly for 20 odd years, that I made assumptions about what they want to get out of chiropractic. And I generally assumed less than what they want. So my assumption was, you're coming in, they write on the thing, back pain. My assumption was they actually wanted to get out of back pain. And then I did a whole bunch of stuff with Russ Rosen, and he uses, I don't know, I've definitely shown you, Amy, I don't know if I've shown you, Helena, these beautiful questionnaire things that are all about functional health, and ask them where they are on the scale and where they want to be and what they want to get out of chiropractic. And I've been absolutely blown away with what people want to achieve. Most people want to be excellent. They don't want to be out of pain. And I don't think I've had anybody in the last 6 months or so since I've been doing this who said, I just want to be out of pain, even though they wrote on their admitting paperwork, I want to get out of back pain. But when you ask the question, it's quite extraordinary what people say. And then my follow-up question to that is, what do you reckon it's going to take to do that? And most people have said ridiculous things like, oh, well, I think it's going to take about a year, and I'm going to have to, change my diet and change my exercise. And when they're asked the question and then they give me the answer, and then I agree, rather than me saying you need 6 weeks worth of care, which is a tenth of what they thought they'd need in the first place, and then expect them to make an agreement with me, I'm agreeing with them about what they think they need. It was a really subtle difference, but people actually want better for themselves than we want for them if we ask them, which I thought was completely cool.
Yeah. And I think too that I like to open their eyes a little bit about what is out there, because we do have patients that come in 3-4 times a week because they're very acute, and we do have patients that come in once a week because they don't need as much care. So when I talk about their schedule, and we'll get to that now, I will say, look, some people come in 3-4 times a week. In your situation, though, I think you only need twice a week. And but it's important that we keep those, consistent, because it's the regularity of the adjustments that's important. And as soon as I'm happy that your body's holding it longer than every 3 to 4 days, we'll try and spread it out to once a week, because I don't want to over-adjust you, but I don't want to under-adjust you. And so, that's where we're going to start. Now, they feel like that schedule is, let's say, personalised to them, which is important, and that you are recognising that they want to try and stretch out the appointments as quickly as you can, and you're open to that as well if it's possible. So I'll say, well, that's fantastic. I'm really confident you've come to the right place. I think we can really help you. I'm looking forward to working with you, because I think it's nice for them to know that it's not just you working on them. You're working together as a team to get them healthy, and that's a collaboration rather than just a doctor-patient relationship. You know what I mean? All right, scheduling. So, what's an appropriate schedule for each case? And experience will help you as you go along in practice. But generally, I think it's good to overprescribe than underprescribe, because it gives you a much better chance to get them better and to educate them. And they will appreciate getting better more than you struggling because you haven't given them enough care. It's very hard to say to someone, look, well, we're just not making the changes we need. You need to come in more, than saying, you know what, you're doing so good, I'm going to drop this back to once a week now. I know we've got another 2 weeks left in the book. Let's just take those other ones out. They're going to love that. They're going to love that, because, they've been doing the right thing and they're improving. So,
you know what I've found really difficult with that when you say it gets easier at the scheduling thing, I've always found it incredibly hard. I still feel it really, really hard. And I think it's a bit prescriptive, and I go twice a week for 3 weeks, once a week for 3 weeks, because it kind of sounds about right. But even then, whatever I say, I forget about it later on down the track. And then I go, I'll see you in about a week. And I've had a couple of people recently say, oh, and I think I'm still on twice a week. I think, that's just negated everything I've said to date.
Yep.
And what I'd really like to do is get the CAs incredibly well trained, so that we come out on a report and say that's twice a week for 3, once a week for 3, and they just stick it in there, and they have the conversation about, it's cool, I'm going to stick it in for this amount of stuff. I know you don't know what's happening with your life. I'm going to make it there because Beck gets really busy. We'll stick it there, and if you don't need it, it will do me a huge favour to have an extra spot in the book there. We can cancel it. But if the CAs can help us, like, back up what we're saying, because I don't know about you, but I'm a bit hopeless with that sort of stuff, would make me not negate myself all the time.
Yeah, the schedule, if you're going to give them a schedule, you absolutely don't want to stuff up down the track where you've forgotten what it is and then told them they can go to 2 weeks and they were still on once a week. I absolutely think that's imperative. That doesn't happen. So writing in the schedule box at the bottom of the treatment page needs to have what it is that you've told them, and you can refer back to that. And then you're right, the staff just have to have it all booked in. That's the advantage of having that those adjustments in, and the review booked in. And I think emphasising that the review is what's important, because we need extra time, and that's what we're striving towards, that we're going to review, and then we can discuss where to go from there. That's the one that if they know that that's in the book, then they'll book up to that point.
And also knowing for recalling and for knowing that things are booked in the book in advance, so that when somebody rings up and says, oh, my kid's sick and I can't come today, that they can just look and go, that's okay, you've got an appointment in a week's time, rather than having to scramble and go, when do I do the recall, and sticking it for 2 weeks' time where they're on twice a week, which just stuffs up everything. You just need one bad CA decision of like, I'll call you in about a week, and not acknowledge that you're on a schedule. And again, everything we say is negated. So we need to get very clear about putting people on a schedule. We need to get really clear about that they need reviews. And from there, we can train CAs to, if we don't, and we all have to be good at it. One person isn't enough. We all get really, really good at that. Then we can train the CAs to back us up 100%. And that's what we've failed on in the past. Our CAs have been a bit crappy because our chiropractors, including myself, have been a bit crappy. And so the whole system falls apart.
Well, it's easy to fall into the habit of, after the first visit or even after reported findings, just saying, let's just see how we go, and then we'll just schedule around how we're going. Now, that infers that your scheduling is around their pain. And if they're out of pain, you can spread it out. And if they're in pain, they can't. And I think most chiropractors that I know, that's the way they schedule. It's intensive when the person's in pain, and when they're not in pain, they can stretch it out. And I'm not sure, I know that that's not a great way to schedule someone, because it undermines why you're adjusting them. It undermines the function, the improved balance, the purpose of restoring proper nerve function and healing doesn't have anything to do with their symptoms. And so be very clear about your schedule and say that to them, rather than be wishy-washy. Let's just kind of play it as we go along. It's just going to get stretched out really quickly, and that's not what we want.
And it's also playing to the majority. I reckon there's always going to be people who break the mold. They've got kids that do sport and stuff that are going to be we have to roll with the punches a bit. Like, we're dealing with humans. But I reckon we assume that everyone's life is really messy and complicated, and put everybody into that mold, rather than assuming everybody really wants what they've got. They've paid $130 up front. They're going, I want your help. If we assume everybody can do what we want for them, and then the outliers, it's okay, we can fit them in around the life, rather than what I think we've done in the past is work to the outliers rather than to the rule. Yeah.
And you'd be surprised that if people are motivated and they're on board with what we're doing, they will find the time. They'll find the time to get in there, and and if they don't, then they can have a conversation with you about it, and then you can say, okay, that's fine. Come once a week. That's completely your choice. I'll work with you with that, but it's probably going to take a bit longer. So, I'll push back that review from 6 weeks back to 12 weeks. That's fine, or back to 10 weeks, whatever it might be. I mean, I think that's a reasonable thing to say to someone that's unable to give it the attention that it needs. So the three most important things to remember on the second visit, I think, is explaining that they need to give it time to heal. So time. Be patient, give it time. Why 6 weeks? Well, I say to people, I give it 6 weeks because I know that that's a good time frame for healing of muscles and ligaments, and will create some level of stability that you can start to stretch your appointments apart. And also, most people, I find, get out of pain within 6 weeks. You might be out of pain in one visit. It might take the whole 6 weeks to be out of pain. I don't know. I'm not your body. I don't know how it's going to heal. But what I do know is that I want to follow this through to get you at least somewhere down the track better than what you were now. And that's what I need the commitment for in that time frame. So I'm pre-framing the fact that I don't care how they feel tomorrow or the next day, really. I'm worried about getting them to the end of that first 6 weeks. So, give it time to heal. Give it some regular adjustments, and they need to be intensive in this first period of care because, I've got to get better function, and I've got to break some neurological kind of segmental habits that are forming because of your body's dysfunction that is going to take time. It's got a memory of that. We need to change that up. And that, I can give you an adjustment and get it perfectly right. It's just going to go back to as it was because it has a memory and your body has all these compensating patterns. We have to change that. And so it needs to have a regular input into the system to make that change happen. So I explain it in that way so that they realize that each adjustment builds on the next. And then I say, you don't have to do anything. Just minimize the bad stuff. Just stop doing the stuff that's setting you back. which is slouching at work, which is eating junk food, which is, you know, those things that you think, look, if you could just avoid doing that, that would really help. I'm not adding all the positives yet. That comes at the review. I'm just minimizing the bad stuff. So yeah, get up off your chair every half an hour and go for a walk. Perfect. That's all I really need until you have that next discussion. So yeah. And in terms of the health and healing, you know, I think that it's something to think about. We can talk more about that philosophically about, well, what's your philosophy of the healing of the body? And what does it take to be restoring your health? You know, if you wanted to get an adjustment once every 6 weeks, would you be happy with that? And if not, well, then don't say 6 weeks to your patients. You know, if you're coming in once a week and then all of a sudden they say, I think I'll just go to monthly, you know, is that going to serve them? Is that going to keep them where they're at? I had a good conversation today with Helena. I think we were discussing about, if you say to someone, I'm coming in once a week and, you know, you need, or fortnightly, and I need to keep you on that schedule because otherwise the problem might build back up again. As soon as they miss an appointment and the problem doesn't come back, that completely undermines that comment. And then they're going to go, oh, I'm just going to wait until the pain comes back then because that's what you said. Whereas the adjustments beyond that,
Can you mute us from?
sure.
Are you controlling? Hang on, I'm just going to mute Helena. Oh. Actually, how about let's all mute apart from Darren until we need to speak. That might be easier.
Oh, could you just hear me?
Yeah, that's all right though.
Now
let's all.
Oh, there you go. I can find it.
All good? Now, okay, so everyone can hear me. Okay, that's all good. I've just got unlimited meetings, but I don't know why. Minutes. Anyway, I think I've just signed on for something. That's fine. All right. So, yeah, so basically when someone gets to once a week, once a fortnight, and they say, do you think I can go to once a month? I will often say to them, you know, yes, you're out of pain and I don't want the pain to return, but it's more about restoring your proper function, proper healing, and your body's going to really know when we go from once a week to once a month. And I want to get you to once a month, but we can't just jump there. It's got to be a process. And I like to give it the same amount of time. So if they're on once a week, I give it weekly for another 6 visits. And then I'll say, okay, I'm really happy with that. I'm going to try 2 weeks. Excellent. Your body's holding. It's not too bad. Let's go fortnightly. And we stretch it out that way. I think we sell ourselves short about how good we can actually get people well by going from once a week to once a month too getting And I think the review is a really important point that we can talk about on another visit where, you know, just getting that review right so that they really want to keep up with that management care leading to an optimal level of function. That's a very big shift in their thinking, because whilst they're getting once a week and twice a week, they're still either in pain or they're thinking that you've done what it needs to be done to get them out of pain, and they're still thinking about that pain. And then when you say, great, the pain's gone, it's really healed well, you're then trying to reframe why they're coming in and find them some purpose for why they're coming in. And I think that's a completely different conversation, and it requires a shifting in their thinking. So yeah. All right. So let's move on. So that's a little bit about scheduling. So look, I encourage you to try and schedule, and we're not strict with scheduling in our office. We really do encourage you to come up with a personalized plan, but I encourage you to at least start on twice a week for a period of time, give them 6 weeks of treatment, whether it's twice a week or twice a week and once a week, and then get to that review. And I think you'll find the compliance is much better, and you have a chance to get them onto being more long-term care plans. All right. And then just quickly, some points to cover in the report of findings. This is based on a chat that I had with Amy the other day. I start the report of findings by asking them, Have there been any changes, anything new? How did you respond to the first visit? I want to just get an idea. It just tells them that I'm interested in, A, how they're feeling. And then whatever they say to me, I go, that's normal. So I'm feeling really bad, I'm really sore, and I'm not sure, if it's going to work. That's okay, that's completely normal. Versus I'm feeling really, really good. That's fantastic. I'm really pleased. It sounds like you're going to respond really well to care. Let me explain why we need 6 weeks of care. And then I recap their main findings. So I say, look, these are the summary of the main points that showed up with my testing. And this is what we want to continue with. These are the changes that I want to see made. And I'm committed to helping you get to your goal. And in that first visit, we found out what their goal was. We're trying to get something more than just out of pain. We want to get you back to, running again, or we want to get you fit again, or we want to help you start to lose weight, or whatever it might be. We've seen all this before. You're not uncommon. This is something that we see a lot of. We get really good results normally with chiropractic care. So that's great. So that gives them another sense that they're in the right place. I like to just reaffirm the chronicity of their problem. So look, this condition took a long time to build, and it's going to take time to heal. So once again, give it the time that's needed, and we'll get there. And I explain about the different stages of chiropractic care and how the adjustments work and how they hold for a period of time, but your body has a memory and wants to go back. And so we're about restoring the body's position and the body's function. And then I talk a little bit more about the cause of subluxations. And I don't mind using the word subluxation, but I like to say that there are stresses in your life that are physical, chemical, and emotional that will cause your body to want to create this problem, which is subluxation, that we are dealing with, and that is still going to be there. Even when this is healed and even when you're feeling better, this is a good reason why, and will help your body deal with those stresses. So it's about their body's ability to cope, and that's what the adjustments do. And that way they can either be really, really committed to reducing the stresses in their life so that they don't have to be adjusted as much, or they can be rest assured that you're going to be there to help them cope better with the stresses that are always going to be there, and there's always going to be stresses. And then we talk about the nervous system chart and how a musculoskeletal complaint actually has a holistic health implication through the nerve pathways. There is, and I like to talk global and local. So locally there is a problem that's causing pain. It's a local manifestation that is stuck, but that has a greater implication with the nerve pathways and their connection with their pathways to their brain, and so they're losing proprioception and losing function. But I try not to go into too much in that regard because that's going to confuse them at this early stage. And then just talk about the healing stage of the first 6 weeks. Let me see what else is here. Yeah, the function. That's cool. And I love saying to them, if you get any worse, or if you're not responding as I would expect you to respond, which is beautifully, then we're going to investigate why that is. So I'm going to send you off for an MRI, or we're going to go to the GP, or we're going to find out what's going on. But rest assured, I'm not going to just keep going with this if it's not responding. So
can I add something to that as well?
Yeah, of course.
We're in such a fabulous situation where we've got lots of practitioners over 3 offices with varying skills. Like I think we've all got the different skills. That even you, Amy, who's only young in practice, you've got skills that we don't have. And to be able to say, you know what, we've had 4 visits or 6 visits, like a small amount of visits, and I really expected this to look better. Your category 2 not to be there anymore, or your C1 not to be in the same position each time. Would it be all right with you if I just get a second opinion? Can you go and see somebody else just so I can get a clean set of eyes? And with the expectation that it's a 1 visit and then back to you with a report on what they saw and you didn't see. And even though, like, I've been in practice more than anybody in the office, I still do it a lot, just because I think the more you do something, the more you keep doing that. And so it's really useful for me to have you, Amy, there, so I can go, I know you kind of know the stuff I know, but you know it differently than I know it. And so I encourage everyone to just don't worry about them moving around. They're not going to go anywhere. It's just if you're a bit wobbly and you think, maybe there's something I'm not picking up, to bounce it to someone for a visit and then have them bounce back. And actually, having said that, I need to talk to Helena a bit about a patient in particular, because I don't think we're communicating particularly well with shared care very much, because there's one patient, Amelia Ritchie, who I've been seeing a little bit, but I need to know exactly what Amelia's expectation is of care. So I kind of know all symptoms and stuff, but I'd really like to have better conversations about where are they in their understanding of their care, and what are they expecting from the second opinions and stuff like that. Maybe we need to have a Skype sort of meeting about that sort of intercommunication as well. So we're all saying the same things and that sort of stuff. I'll unmute now.
Did you want to comment on that, Helena?
Yeah.
Yep.
Sorry.
Yep, go.
Yeah, that sounds good.
Yeah, cool. I mean, the other thing that I will say to people is, you're, as a member as a patient here, you're a member of our office, and you're entitled to come in on any day, see any practitioner, and we all understand each other's notes, and we all share clients. So if I feel that you can get better care, or someone has a better expertise to be able to look after this, I want you to see them for another set of eyes. Also, would you mind if I bring your case up with the team, because we do discuss case studies, and I'd really like to try and nut out what's going on with you. So if you don't mind, I might discuss this and then see if I can help out. And they'll always go, yeah, that'd be great. So they're really appreciative of the effort that you go to, and any effort to try and help them the best they can. And they like to know that you're expecting something that's not happening. Like, wow, you're in pain. I wasn't expecting that. That's really unusual. Like, they don't want to hear, oh yeah, whatever, lie down, So, I think that you can, it shows great humility, and they appreciate that when you say, I don't know. Like, I don't know why your knee's sore. I don't know. Let's lay down and have a look, and I'll see what I can find. But, you don't have to diagnose everything and know all the answers to everything. I think that's important. I didn't have too many more comments on this. So is there any other kind of issues that you guys want to chat about? The language that I use in the office when they come in, I've been really trying to say things like, "G'day, Mark. How are you moving at the moment?" And then I'll say, "How are you well? And is there anything I need to focus on today? Are there any issues that are concerning you?" Great. And then whatever they say, I say, "Okay, great. Let's lie down. Let's check you." I think that's a way that you can hear them, but then you don't treat them, or you don't go to their issue. So I'm getting this really bad foot pain that goes around my ankle. Okay, well, let's just check and see whether that's coming from your pelvis or your spine or something like that, because really that's what we do. And, it's funny, I've been starting to use this thumper machine in the office a little bit, because patients have been coming in that I'm just trying to shift something differently that I haven't done before. So I said, look, I'm going to be doing this kind of weird thumpy physio thing with you, because I just want to see if I can change it up. And it might offer something different to what we've been doing. And they appreciate the fact that you're trying something different. Now, I'm absolutely not going to get in the habit of using my thumper on every visit with every patient. But for me, it's been something that is just, it's just something more that I'm offering them, that they're appreciative that it's not the same thing, over and over.
Can I add something to that too? I think it's really interesting that you call it out as not chiropractic. I think it's really important that we own chiropractic and say, sometimes we do stuff that's adjunctive therapy. And if you use a thumper, you go, I'm using physiotherapy. Or if we rub cream into something, we're using physiotherapy. Or if we're giving supplements, where this is supplements, this isn't part of chiropractic. And having, this is chiropractic and this isn't chiropractic, but we're clever. We can do a lot of stuff. I think it's really helpful to distinguish why they come to us rather than why they go to somewhere else.
Yeah. Yeah, like a little boy came in today, he had a sore leg. I gave him a rub, put some cream on it. But I didn't charge him because, I felt like saying, look, we didn't do any adjustments today, so, don't worry about it. I mean, we spent a little bit of time with him, but I think for that sort of thing, I was quite cool with just letting it go. So, yeah. All right. So, I think the bottom line to finish up on the report of findings is to be prepared. So to spend a good 20 minutes reviewing the patient's file before you go in, so that you're on top of why they're there, what they've walked in with, all the testing that you did that was positive, and really just kind of nail it. Have your schedule already in your mind, and have spoken to the front desk staff about that so that they know what you're going to come back with. As much as they can already know that you're going to be twice a week for 6 weeks, or twice a week for 2 weeks and then once a week, I really think just that extra second of walking out with the patient at the very end and saying, great, Shane's going to be organising your appointments for your schedule of care. Shane, it's going to be twice a week for 2 weeks and once a week for 4 weeks, and then we're going to do the review. No problem. She says, yeah, no problem. So you're reiterating with the patient in front of the staff. There's no way that they can get around the fact that you've communicated that with your front desk. If you just say it to them in the room and then they go out to the front desk, there's a good chance that Shane says, so now you're on twice a week for 6 weeks, and then they go, oh yeah, I can only make that for 2 weeks. And I think just for that second visit, just to say it to the staff in front of the patient, and then it really does reiterate it. Yeah. All right. Any other comments? Has everyone had enough, or do they want to keep going with some more stuff?
That's good. I'd love to do these regularly and short.
Can you just say that?
Put questions to it as well, so we can kind of all come with questions and be interactive, and just do them really often.
Yeah.
That'd be awesome. You'll go, Helena.
It just cut out, so I missed that last paragraph or so that Darren said. Like, I have no idea what he's saying.
Can you hear me now?
Can you hear me?
Yeah. Yep, I can hear you. Can you hear me?
No, I can.
No.
No.
I was just talking about how when you give the schedule of care, it's cut out again, I think.
Kind of. Let me
yeah, you mute yourself. There we go. Okay, so what I was saying was that when you give your schedule of care, say it in front of the patient to the CA at the front desk, so that there's no confusion. Cool. Are you still there? Yep. I think Helena's lost us.
Thanks for doing this tonight. It was really good.
Oh, that's good. No worries. Well, I've got more. Like, the next little topic I had was maintaining the regular monthly client. So these are things like how can we be hyper aware when a patient is trying to phase themselves out of the office? And there are a lot of little red flags that are going to come up where you go, oh, you know what? They're either going to cancel the next appointment, or they're just going to keep spreading it out. So, and it's really how to set up a special visit with them, and then basically just get them back on track. So, because I think it's a real shame when a regular patient has been coming for years and years, and all of a sudden they just miss an appointment and then they're gone forever. And you go, like, where did they go? They're not responding to my calls. Why aren't they coming back in? And perhaps there was a way that we could have nipped that in the bud earlier when we picked up on a few things going along. So,
I'd really like to have some conversations about how to respectfully let people drop out of care if they want as well.
Yeah.
Because I've had a couple of people lately, after doing this kind of asking what they want and then honouring that, and then a couple of them have said, okay, I've done my 6 weeks, and then they drop out. And then they came back 6 weeks later and took on a different set of care. And it was really interesting to how to respectfully let people kind of do what they want to do rather than...
Oh, Beck just dropped out. I agree with Beck that there is having an exit strategy is really important, and telling them that the amount of care they want to is up to them. There is one way which I've learned, which we may or may not want to adopt, but it basically says whenever you want to stop care, what we do in that format is that we schedule a special visit. And that is an exit visit. And basically, it's a retesting of where you are. It's a snapshot of your health at this point in time, so that, now hear my language, so that when you return to care, we can see what changes have happened from when you stopped care. So, awesome, come on in, we'll do the special visit. Let me just retest where you're at. Awesome, we've got all that documented. Give me a call when you're ready to come back for care. Awesome, I'll see you later on. And then that's a nice way, rather than them just kind of sneakily trying to, drop out of care. So we can talk about whether that suits our practice and whether we want to do it that way. But, I agree, Beck, that honouring their care and how much they want to get out of it, and being able to see them in the street and say, "G'day, how are you?" and "It's nice to see you," without them feeling guilty that they haven't been in, is what you want, So yeah, we can talk about that. Now that'll come down to that about phasing out the patients and those people that are dropping out of care and how to, get them back in and that sort of stuff.
Just on an admin thing, you can't see the sidebar of comments, can you?
Me?
Oh, you can to the side.
Yeah, I saw the comments.
Helena, can you see the chat?
She's not here anymore.
Oh no, Amy can see the chat.
Have you got the chat down the bottom?
Yeah, I've got the chat.
No.
So if you just press, you
No,
might be able to
I don't.
Are you on your phone?
Yeah.
Maybe it doesn't have a chat section on your phone. That's all right.
I've got participants, and I can raise my hand.
Ah.
Did I do something?
Oh, wow.
Oh, that's cool.
I don't know what that was.
I
can stop the video. I can share content. Is that it?
Oh.
No,
Screen,
I think
iCloud photos. No, cancel. I
There
can.
should be a chat option, because when I did the Zoom,
Oh, yeah.
I could chat.
Yep.
There's a chat option there. There's also a bit which
The
I like.
participants. There's
I've
chat.
got a share
Yep. And then I can see. I'm on 2% batteries. That's what Beck just said.
screen. So I've got a share screen here, so I can share my screen and I can put this up, so I can put notes up. Can you see those notes?
Oh, that's awesome.
Yeah, let me just.
There we go.
Oh,
So-
yay. Yes.
That's awesome.
So I can talk about it. If I'm doing a presentation with you guys, I'll go through the presentation with a slideshow. I can talk, and then you can just watch it as I'm going along, and we can go.
This is a really cool tool.
Yeah, it's good
Isn't
too.
it?
It's so good.
Particularly when there's so much of us, and we've all got families and travelling and
Yeah, and we're all at different clinics as well, so trying to organise us to all meet up is really difficult.
So this one said
awesome.
that I had 40 minutes though, and it said, "Oh, you're about to run out of 40 minutes. Do you want to continue?" I don't know what it meant when I continue. Whether that's I don't know
Signed
why.
up for life.
I probably
Whether you're paying.
yeah. Oh,
Can we get those? Can we take a picture of those notes? No,
Would you like me to email them to you now?
I don't know what to do with that.
Yeah, email would be great.
Yeah,
That'd be great.
I'll email them to you now.
Because then I can, because then I can think what you guys said and read it through.
Yeah. All right. So I'll send.
Can you
those
still hear me? Okay.
again. Yeah.
Yeah.
All right. So
Brilliant.
I'll send those through. All good.
awesome. That's brilliant.
And
And I also
Thanks, Darren.
in the habit
was
of not
great.
doing them all. I'd really like us all to like kind of run them, because otherwise it's all going to be your voice
yeah.
telling the stuff. Everyone's
That's
trying
fine.
to think of something that they have a challenge and maybe ask the question. You don't have to have the answers, but say, I'm having a real challenge with this. What do we as a group think about it?
Yeah. Like it's good to have conversations. I think role playing though is a bit easier face to face. Like,
Yeah, I agree.
all right. So Amy, go through report of findings with that person in that case, and we'll kind of review it as we're going along. That's better face to face, I think. But yeah. All right. Thanks, guys.
Thank you. Bye.
Cheers.
Yeah.